Absolutely, Madam Chair.
Great, thank you so much. I'm calling this hearing of the Boston City Council's Committee on City Services and Innovation Technology to order. For the record, my name is Kenzie Bach. I'm the District 8 City Councilor and the chair of the City Council's Committee on City Services and Innovation Technology. I'm joined here today by my colleagues, Councilor Erin Murphy at large, and also the sponsor of this order, Councilor Ed Flynn, District 2 and Council President, Councilor Ricardo Arroyo, District 5, Councilor Julia Mejia, District at large, Councilor Frank Baker, District 3, and Councilor Ruth C. Louis-Jen, also at large. Also be reading an absence letter in a moment. This public hearing is being recorded. It is being live streamed at boston.gov/city-council-tv and broadcast on Xfinity Channel 8, RCN Channel 82, and FiOS Channel 964. We will be taking public testimony at the end of this hearing. So if you're interested in testifying and you haven't signed up yet, please email ccc.csit@boston.gov. With your full name and your neighborhood or town, and we'll get you the link. And if you could just make sure that your Zoom handle matches the name you gave us so we know that it's you, that'd be great. Today's hearing is on docket 0246, order for a hearing to address the changes to the Memorandum of Agreement, MOA, that the vaccine mandate created. And I just want to repeat that email address I just gave one more time. So for public testimony, ccc.csit@boston.gov. And for folks who are waiting to testify, you're in the waiting room. We know that you're there, and we'll move you over when we get to public testimony. Today's hearing, there's going to be a few sort of aspects to how it runs that I want to explain up front. The City Council, obviously, when we take our oaths, promise to obey the city charter, and the city charter has an exclusion in 17G. That section of the charter that says that the council is not meant to be involved in the making of contracts or the employing of labor on behalf of the city. And so it always creates a little bit of a complexity when we want to talk about an active bargaining matter like this. And I think there's good public policy reasons for the council to be able to hold hearings like this. But when we hold them, we kind of structure them in a way to make sure that they don't appear to be open negotiation sessions and that the councilors are not bargaining on behalf of the city because of that charter language. So the way that today's hearing will run is we'll hear first from the administration. Dr. Bisolo Owusu, who's the executive director of the Boston Health Commission, is here, and we'll have councilor questions for her. And then we will move to a panel of representatives of our municipal bargaining units, a number of them. I also have some written testimony from municipal bargaining units, which I'll be reading into the record. For that panel, councilors will ask questions on the administration side. Councilors will not ask direct questions of the labor panel because, again, of the concern that the dialogue creates an appearance of negotiation on behalf of the city. That's been our practice on similar matters before. What I will do, however, is give councilors an opportunity for statements following the labor panel so that if people want to make a statement, react to what they've heard, they can do so, but we just won't do it in the dialogue way. I do have a letter to read from the administration. As I said, we've been joined by Dr. Owusu to explain the BPHC side of this matter. But because of the nature of the active negotiation, the Office of Labor Relations sent us a letter declining our invitation. So I'll just read that into the record now. February 11th, 2022, dear Chairwoman Bach, thank you for the invitation to testify at today's hearing regarding docket 0246, a hearing regarding MOAs and vaccine mandates. Unfortunately, I must respectfully decline your invitation. As the Director of Labor Relations for the city, I cannot disclose confidential matters such as collective bargaining strategies or objectives at a public hearing. The administration's utmost responsibility is to maintain the health and safety of our workforce. We will continue to negotiate in good faith with our collective bargaining partners to ensure that result. Respectfully, Tammy Poost, Director of the Office of Labor Relations. I also want to read an absence letter that I received from a colleague, Councilor Michael Flaherty at large, February 11th, 2022. Dear Chairwoman Bach, unfortunately, I am unable to attend today's hearing on docket 0246. I will review the video and testimony submitted into the record. I'd like to reiterate my support for the continuation of a weekly testing option, as well as my opposition to and concern about a vaccine mandate policy that causes people to lose their livelihoods and careers for noncompliance. We know that vaccines are a critical part of our COVID-19 public health response, reducing the likelihood of severe illness, hospitalizations, and death. We also know that testing is also a valuable tool that allows us to track, contact trace, and quarantine infected individuals to reduce the spread of COVID-19. I look forward to continuing to work with my colleagues and the administration to help our city recover from the COVID-19 pandemic. Should you or any member of the public have any questions or concerns, please do not hesitate to reach out to my office directly at 617-635-4205 or at michael.flaherty@boston.gov. Sincerely, Michael F. Flaherty, Boston City Councilor at Large. So that will be entered into the written record as well. So for councilors who are here, because we have the administration here and there is some time constraint, I'm not going to do full opening statements. I am going to give the lead sponsor the opportunity to do an opening statement. We'll hear briefly from Dr. Ojikutu, and then we'll go straight to questions. And so that should give councilors an opportunity both to ask their questions and express any opening comments they'd like to. With that, I will pass the floor over to the lead sponsor of this docket, Councilor Erin Murphy at Large, for an opening statement.
Thank you, Chair Bach, and for everyone who's here on this call, this hearing today, for attending. So I want to start by saying I understand that the vaccine is drastically proven to reduce hospitalizations and severe disease, and I do applaud the administration's effort to increase the number of city employees getting vaccinated, and we have the highest vaccination rate across the country, or pretty close to it. So I applaud that. I encourage all residents who haven't been vaccinated to go to one of the many sites that are still open across the city to make sure that you are vaccinated. It is important for the health and the welfare of our city. But I know this is a controversial subject and there are strong emotions on both sides. But I'm holding this meeting so that we can have a forum, so that we're able to discuss the facts and have the opportunity to have all sides heard. And I strongly encourage that we conduct this hearing in a respectable way, even if we don't agree and we have differing opinions. So when I call this hearing, the public hearing directly from I call this hearing for the council and the public to hear directly from the Wu administration and the Public Health Commission. What the questions that I have for now are: what metrics are we using to determine how long we stay in a public health emergency? Another question I have is why a few months ago under Mayor Janey, when we signed an MOA with the city employees, was testing an option and it was safe then. So I'm wondering, what data are we using now if we're determining that testing isn't an option for our public, our city employees? And also my question is, what impact did this change to the MOA have on our city employees? And did the unions have an opportunity to sit down and negotiate these changes? So I'm hoping when we hear from Dr. Ojikutu, we can answer some of those questions, and also that the unions have an opportunity to weigh in, and my colleagues also have the opportunity to ask these questions. So I'm hoping that with this transparency and a better understanding of what metrics we're using, what phases, the red, yellow, green phases that I know we've heard about. So I'm looking forward to the conversation to get a better understanding on all of these issues. So thank you.
Thank you so much, Councilor Murphy. I think like I said, with councilors, we'll go straight to questions after we hear from Dr. Ojikutu. So Dr. Ojikutu, you now have the floor. I think this is, no, I must be wrong. Have you come to a council hearing previously, or is this the first?
I think this is my first, right? I've come to council meetings, so I've met a number of the city councilors. Good to see you all again.
Well, welcome to the virtual.
Thank you. Thank you. I appreciate that. Good morning, everyone. Good morning, Chairperson Bach and members of the committee. My name is Dr. Bisolo Owusu. I am the Commissioner of Public Health for the City of Boston and the Executive Director of the Boston Public Health Commission. And I really want to thank you for bringing us together today to talk about and discuss this important topic. Since early in the pandemic, the Boston Public Health Commission has been continuously tracking many different metrics to guide the city's response. And I guess I want to start out by saying that I'm currently optimistic about where we are in terms of the pandemic. The core COVID-19 metrics that we're using as a framework to guide our policy and programmatic decision-making are thankfully all trending in the right direction. So earlier this week, Mayor Wu announced the current Be Together proof of vaccination requirement for indoor dining, entertainment, and fitness spaces would be lifted when the following conditions are met. And those conditions are that we would have fewer than 95% of ICU beds occupied. And as of our most recent data, we have an occupancy rate below that threshold, so at 89%. Secondly, fewer than 200 COVID-19 hospitalizations per day. And as of our recent data, we have 387 adult COVID hospitalizations per day. That's not below threshold, obviously, but it is down from over 780 in mid-January. So that's significant progress. And then a community positivity rate below 5%. So as of our most recent data, our community positivity rate is 7.4%, and that's down from a high of 32.7% in the first week of January. So as I said, I am optimistic things are trending in the right direction. And based on our current projections, I anticipate that all three of these thresholds will be met in the coming weeks. I want to say that I'm confident that vaccinations and policies that require vaccination, encourage vaccination in certain settings, have played a strong role in preventing this most recent surge from being worse than it was, and allowing us to return to below these thresholds more quickly than we otherwise would have. As many of you all know and have talked about it, at least when I've spoken to you, vaccines are just a critical component of this pandemic, of getting through it. And we know that they are safe, they are a very effective way to protect ourselves, particularly from severe illness and hospitalization and death, as well as the long-term effects of COVID, which can be devastating and certainly include, things that you all have heard of in terms of long COVID, like fatigue, cognitive disorders, and other, long-term effects that we all would like to avoid. I think that vaccines are the most important tool that we have to prevent COVID-19 transmission and spread, and certainly, as I said, incredibly important in terms of severe illness and hospitalization. So the Commission has taken a multi-layered approach of encouraging testing, vaccination, boosting, and masking to promote equity and mitigate racial disparities in health outcomes and vaccination rates. And I think that all of these have been critical to getting us to where we are, which I said is a good place right now in terms of our trend. I'd also like to highlight some of the disparities and ongoing concerns regarding inequity in our city while I'm able to. So Black residents are one of the lowest vaccinated racial groups in the city, at only 69.5% fully vaccinated compared to 75% of white non-Hispanic residents. And if you look at that data, Black residents have accounted for a disproportionate number of COVID-19 related deaths. And we recognize that this is not solely due to low vaccination rates. There's certainly underlying issues, structural, systemic inequity issues, systemic racism that have led to poor outcomes for Black residents, as well as Latinx residents and other vulnerable populations in Boston. I'd also add that amongst Latinx residents, case rates have been significantly higher than the citywide average throughout the pandemic. And vaccination for our youngest Latinx and Black residents are also significantly lower than white non-Hispanic peers, which is why we really place a major emphasis on making vaccines more accessible, decreasing barriers, and encouraging vaccination across the board to encourage access and meeting communities where they are. Beginning in early December, we hosted a number of free walk-in vaccine clinics in neighborhoods with low vaccination rates and known high barriers to access. And we've supported twice weekly walk-in vaccine clinics at City Hall. We've also expanded hours at our neighborhood clinics to support working families who can't take time off to get vaccinated during the day. And we work really closely with the city workforce, the city staff, to increase their access to vaccination clinics. And the Commission is also working closely with our state partners to make initial doses and boosters just more accessible across Boston citywide. I think it's also important because testing is a critical part of the strategy that we've ramped up testing access by standing up new testing sites in communities with high positivity rates and barriers to purchasing rapid test kits. So essentially, as I said, with this multi-layered strategy, we've been increasing access to vaccination, increasing testing, as well as encouraging masking and other mitigation strategies to, respond effectively to the pandemic. So I think that the steps that the Commission and the City of Boston took to address the Omicron surge, particularly including the implementation of the Be Together vaccination requirement for certain indoor entertainment, dining, fitness establishments, as well as strengthening the city's employee vaccination policy, were necessary to prevent the spread of COVID-19 and prevent severe illness and death. And I think that that's consistent with our authority to protect the health and well-being of the public and our workforce. And while I want to acknowledge the important role of the employee vaccination requirement in increasing vaccination rates and preventing severe illness from COVID-19 among city employees and those that they serve, really the scope of my testimony here today is limited to public health data and information that inform these decisions in regards to like the metrics and the things that I've just spoken about. So I guess I'll conclude by saying there's reason for optimism right now in regards to the metrics that we are following, but I don't want to, say that we're totally out of this, obviously. I want to, encourage some caution and continued use of the mitigation strategies that I've mentioned through testing, increasing vaccination, boosting, as well as masking. And so I'll stop there. Thank you to the committee for allowing me the opportunity to testify today, and I'm happy to answer any questions.
Thank you.
Thank you, Dr. Ojikutu. So I'll now go to counselors in order for questions. And I'll just remind counselors to keep it to 5 minutes. If you hit that time, I'll raise my gavel so you can visually see. And if we need to go to a second round, we will. The order is, I'll defer mine to the end. Councillor Murphy, then President Flynn, Councillor Arroyo, Councillor Mejia, Councillor Baker, Councillor Louis Jen, and I think I neglected to mention before that we'd also been joined by Councillor Brian Worrell of District 4. So Councillor Murphy, as a sponsor, I'll go to you first.
Thank you. I know in my opening statement, I kind of touched on some of the questions, but I'll reiterate those. This meeting, hoping is to provide a forum other than protesters, outside to share our concerns and ask questions to get some good answers here. So my first question would be about the metrics we're using, and if we're moving in and out of a red and yellow zone, how is that going to affect our city employees? If they're saying like we have to meet all 3 metrics, and also what data are we using? I know when looking on the website, the public health website, they're not being updated often. So how often are those metrics being updated that we're going to be using to determine our city employees being able to come to work or not?
So thank you, Councilor Murphy. I will try to answer those questions. So our dashboard originally was updated once weekly. That was, sort of the goal when I took on this role. Since we, have been really focused in on data and using sort of data to drive policies, we've now started updating it twice weekly. We're also migrating the dashboard to boston.gov. So there may be delays in that process, but certainly we're putting out there the data, the 3 metrics that I mentioned, the ICU bed occupancy, the COVID-19 hospitalizations, and the community positivity rate, to ensuring that data is quite visible for people to see and to follow over time. In terms of your question about moving from red to yellow, the idea is that the reason that we are, in this red zone is a combination of factors. So it's about the fact that, our resources, our healthcare infrastructure is very stressed, meaning that, there's a lot of pressure on our healthcare system, and we're using ICU bed capacity to measure that. And that's over 9 hospitals, the 9, sort of major hospitals in Boston. And so we thought that was a good measure because we saw it fluctuating, and yes, it has dipped lower. So it's underneath 95%, which is great. That means there's a sense that our healthcare system is under less pressure. Secondly, this issue of severity of illness. So that's when we're looking at the COVID-19 hospitalizations per day. And as I mentioned, they're going down significantly. So we've had a decline of maybe 25 to 26% per week that we're seeing. So we, have gone from, as I mentioned, the high 780 a few weeks ago, now to 387. And I anticipate that will continue to decline, and we will see this underneath our threshold, our 200 threshold, within the next couple of weeks, if not even sooner. And then this issue of community positivity rate, which is actually a measure of the number of people who test positive over the number of people who test. And so that was set earlier in the pandemic at 5%. As I mentioned, it was quite high at 32.7%. Now it's gone down significantly, and we're continuing to see a trend down. The interesting piece of that is that we're also looking for correlations in the viral wastewater, which we believe is a good and has been validated as a good surveillance measure, across Massachusetts. Specifically, we're getting some data from Boston so that we can have a better sense of exactly where we are in terms of the pandemic. So we really do think these metrics, as well as the others, because we certainly look at other factors. We look at pediatric hospitalizations, we look at bed capacity, we look at number of tests performed. There are many different factors that I think go into understanding where the pandemic currently is throughout the city. So I hope that helps, at least understanding how we're looking at this. We're certainly not just focused in on any one thing. I don't think any one metric is going to help us. It really is a combination of metrics. And as I said, all three would need to be below the threshold for us to move out of this red into a lower level in regards to the red, yellow, green schematic that you may have seen.
Okay, thank you.
Thank you, Councillor Murphy. I'll go next to President Flynn.
Yeah, thank you. Thank you, Councillor Block, and thank you, Doctor, for being with us. Doctor, my question is, we've been dealing with COVID now for 2 years. Mm-hmm. I actually held the first public meeting in the country when COVID first came out in January 2020. At the Josiah Quincy School. I guess my question is for city employees that may have contacted or been exposed to COVID, tested positive for COVID, we don't necessarily know what the long-term effects are on them, on these employees or their families. How are we going to study long-term effects on employees that may have been exposed, may have been tested positive for COVID? Because long-term, there's going to be medical challenges for people, but also there's going to be challenges for people, for employees relating to retirement, relating to disability-related issues. It's similar to the military. I've retired from the military after 24 years of service, and I've had some medical challenges because of that, but that's all documented in my medical file. But are we making sure that anyone that has COVID is able to get the necessary services, is able to get the necessary medical care, but also long-term? I think we need to have a long-term strategy of dealing with city employees that might need further assistance from human resources. So I'll stop there and just want to listen to your response. Thank you, Doctor.
Thank you, Councillor Flynn. I think that's an excellent point. So long COVID, which is what you're talking about, is a complex entity that I don't think medical experts fully understand at this point. There is evidence that, COVID can impact, all organ systems. So I think I mentioned in my opening statement, cognitive issues, but certainly ongoing lung problems, ongoing heart issues. These are all things that we know do happen in a subset of individuals. There is evidence to suggest that vaccination decreases the risk for severe long-term COVID, because I think we're looking at long-term COVID as a spectrum, not just one sort of thing. So the commission is actually a part of a coalition across the city that is working on a study to look at long-term COVID, particularly in Boston City residents. It's multiple academic centers. The commission has been at many of the meetings. I was in academia, still in academia, sort of prior to taking this role, and was involved in sort of coordinating some of that work. So that's something that we're obviously, it has to be something that we're focused in on. In regards to what we do, for employees, certainly our occupational health refers people to PCPs, tries to help people get access to care, when they report a positive test, when there's a highly suspected case. That's all part of our process. But I agree with you. We need to be very mindful of the fact that this isn't over when we get to a positivity rate less than 5% or lower than that. There will be these long-term consequences that we need to be mindful of and be planning for. And like I said, those the studies I think that are ongoing are going to be incredibly important. So I appreciate you bringing up that issue.
Councillor Flynn, you're muted.
Yeah. Thank you, Doctor, for the response. I have further questions, but I'm going to hold off on them, and maybe I'll ask them offline, Doctor.
Great. I look forward to talking to you.
Okay. Thank you, Councilor Bach.
Thank you, Councillor Flynn. Next up is Councillor Arroyo, and then it'll be Councillor Mejia. Councillor Ricardo Arroyo.
Thank you. I just have two questions. The first one you may have the answer to, or you may not, which is, since the vaccine mandate has gone into place, do we have the data for how many additional vaccinations, whether in percentage or actual number, have been taken since then? And then two, there's a lot of conversation about vaccinations or testing. Isn't it true that we should actually be aiming for vaccination and testing, that if we actually want to control the spread of this, if we want to actually put a dent into this, we have to have people both vaccinated and testing regularly, rather than just testing regularly and or vaccinated, that the only real way to get a grip on this is if we're doing both of those things together?
So thank you, Councillor Arroyo. Another great question. Absolutely. This is a multi-layered strategy. You can't do one or the other. You need to be testing, and people who are, irrespective of their vaccination or boosted status, they need to be testing. The only way that we will understand the progression of the pandemic over time, to even understand, again, if there are new issues, new variants, understand what may happen in terms of repeat infections and immunity, immune evasion, and all the sorts of things that we're very concerned about. We have to keep testing people, which is why we established the additional testing sites, and we are doing, expanding the role of rapid testing and ensuring that people, communities that may not necessarily have used rapid testing, if it was over the counter, they had to pay for it, know how to use it and know how to use it effectively, to not only understand that they are, positive and they need to isolate, but that, they can make sure that they're protecting their, in multi-generational homes, their elderly people living in their household and whatnot. So testing is critical, as is vaccination. So it's a dual strategy. So I was just looking at our data today, and I have been following it over time. So after a couple of weeks, we had several weeks where our initial uptake of COVID-19 vaccine by week were stagnant. And it's not that people weren't getting an initial dose, but we weren't seeing an increase in the number. Around the data around January 11th, we saw a pretty steep increase in uptake. And then by January 18th, we had about a 17% increase. And that was in the first week and a half or so of implementing this policy. That's something that was seen similarly in New York City when they implemented the policy. I don't know that that's, it looks like that is not necessarily, I mean, we can look at the data over time and kind of see like what the trend will be and kind of like what is actually going to happen. But we definitely did see an uptick. We have been looking at, whether or not we should be doing surveys of people when they come in for their first dose to figure out what motivated them, what specific thing actually made them, come in at this point in time to be vaccinated after, many, many months of having access to vaccination. So we're working on it. I think that's, it's obviously our interest to know what is it that triggers people to be vaccinated, but we did see that increase in uptake of new people getting vaccinated.
Councillor Arroyo, were those all your questions?
Yeah, no further questions. Thank you for those answers.
Thank you.
Thanks. Next up will be Councillor Mejia and then Councillor Baker. Councillor Mejia.
Yes, good morning. I just have two questions. From what I understand, COVID was the leading cause of death among law enforcement in 2021. And I'm just curious, what more do we need to do to ensure that our officers are not contracting COVID or spreading it? And then the next question that I have is for city employees who have been out of work due to COVID or lost someone to COVID. It could be a very traumatic experience. And I'm just curious, what are we doing to provide mental health services to city employees during the pandemic?
So two really great questions, and thank you, Councilor Mejia. So I think that this kind of goes back to what I was saying before about the idea of using a multi-layered strategy. You know, our city workforce is largely vaccinated. I mean, I believe that the percentage is 95% vaccinated. So many people have gotten vaccinated. We offered vaccination, trying to make it as easy as possible for people to get vaccinated. So certainly that's an important leading strategy to address these issues that you're referring to in terms of decreasing severe illness, decreasing hospitalizations and death. But on top of that, we need to provide people with appropriate PPE or masking, you know, and encourage understanding of the best ways to mask. I mean, you need to have a well-fitted mask over the mouth and nose. And we ordered a large supply of surgical medical grade masks, as well as higher grade respirator masks, so the KN95s. And those need to be provided to our direct service providers, specifically, you know, law enforcement, EMTs, everybody who's going to be in direct contact with the public. It's really critical. And the other thing, again, going back to testing is an important mitigation strategy. You know, if you have been exposed or you've you know that you're going to be in a space where there are going to be people who are at risk, certainly testing beforehand is important, and certainly isolating yourself or quarantining if you've been exposed is critical. So emphasizing those strategies, I believe, is incredibly important. In terms of mental health issues, that's an incredibly important piece of the puzzle here as we think about how to continue to manage COVID as, you know, it becomes endemic and, you know, we have decreased rates. You know, hopefully, you know, we should have been doing this all along in terms of, you know, addressing mental health needs. And I know that this is one of the priorities of this administration, and we've been working on, you know, sort of a citywide mental health initiative that I think is going to be very important, looking at, you know, not only, you know, workplace issues, but certainly community issues in regards to mental health, because I think that is an incredible unmet need within our communities citywide. So I think it's an important need. We do refer people for mental health supports. Certain departments have peer support efforts that are moving forward. But I think what we need is really a coordinated effort to ensure that these issues are amplified in our response. And that's what we're working on now. And the commission is very much so involved in that process. So thank you so much for highlighting that. And we will, you know, move forward with those efforts going forward.
Yeah, thank you. Thank you so much. Councilor Brock, I don't have any further questions. Thank you.
Thank you so much, Councilor Mejia. Next up is Councilor Baker, and then it will be Councilor Louis-Jen. Councilor Baker.
Thank you, Madam Chair. Dr. Ojikutu, thank you for joining us today. Sorry that they threw you in the middle of the fire all alone here. I'm going to be very respectful to you. Nice to see you today. Well, a couple other things. It's amazing to me the amount of work that this administration and this council have put in behind trying to not have this conversation. The press conference was in mid-December. There are no matrix or no roadmap as to what we're looking at. We're just rolling out vax passports and mandates on city workers. And here it is 2 months later, and we're just now starting to see those matrix. So that to me is hugely disappointing. Another huge disappointment, we spent the time in the last meeting making sure that this did not go into the health, the public health committee. We sent it to labor, and the director of labor relations, Tammy Post, is not here. Are we going to need to subpoena her? That's a rhetorical question, Madam Chair. With that all being said, Dr. Ojikutu, you were part of the decision-making process went with the previous administration with acting Mayor Janey that came up with the MOA with the labor unions. Can you, as much as you can, talk to us about the decision-making process around how did acting Mayor Janey get to that decision? And then also, how did this mayor get to this decision she made, knowing full well that these decisions were not brought up in front of the public health board? There was no discussion around them in December, January, February. So as best as you can answer those two questions, that question, decision-making process, can you talk to me about that?
So thank you, Councilor Baker. So I actually wasn't involved in the process that you described. So I started my job in September, and I don't know who was at the table per se, but I don't have any insight to offer to this discussion about that. What I can say is, I have regular meetings with Mayor Wu's team. The commission is working directly with the administration to look at what you said, developing a roadmap, having very clear guidance as to what should be implemented at different levels. Looking at our metrics, evaluating our metrics, validating our metrics. We spend a lot of time thinking about the data behind the decisions and behind the guidance that we have provided to this administration. But I don't know that I have much to add in regards to previous work.
Okay, I thought you were there before that. So this decision is made in the mayor's office. It's not, we don't have, the public health board has no say in on this at all?
No, so the Board of Health is appointed by the mayor, and the Board of Health provides oversight of the commission. And so the Board of Health has been briefed on this situation, and they are aware of what's happening. We've had multiple meetings with them. Our last meeting was January 12th, where I briefed them on all active orders issued under that March 2020 health declaration, as well as any related litigation. So they were definitely briefed on the issue.
Okay, so can you talk a little about three matrix that we have? It's 95% ICU beds, and when this was early on in the first phase, I guess, of COVID, when we were having full-on discussions with the administration and with public health, which discussions that have not happened with this administration. The talk around, one of the big things for us was to make sure that the hospitals and healthcare industry was not overloaded, which is why when we're in the throes of this, we were standing up failed hospitals and the like. So if it's 95% ICU beds, I know, or I think, and if you can explain it to me, in Boston, we don't operate from 100%. So 95% ICU beds does not mean that we only have 5% left. Is it 130% that we operate?
No,
can you explain that a little bit?
Yeah, so these are non-surge beds. So that means that we haven't entered surge yet. Surge is when you hit 100%. Though some hospitals will go into surge under 100%. We indicated and gave 95% that the designation of threshold so that we would have a buffer to mobilize any efforts to increase ICU bed capacity if we were dealing with a severe pandemic, a severe variant, as we were, earlier on in the pandemic. So there is definitely surge capacity. We are very lucky in our city to have, tertiary hospitals and places where, they can certainly expand beyond 100%. There was a period earlier in the pandemic where we were near 130%. So that is the case, that we do have surge capacity.
Early in the surge, meaning 2020, or in the last couple months.
No, this is earlier. This is before that. So surge, say when I mean surge, the previous seasonal sort of winter surge, we were higher up, above the 100%.
So even being at the 85, 89% now, we're not concerned. Well, the concern is always there. We're not as concerned with the healthcare industry being overwhelmed like we were back in March 2020 or April 2020?
So I think I think you're bringing up an important point. When we're considering our healthcare system and our hospitals, there are multiple metrics to look at, right? So ICU is one. And I mentioned that we have to really think beyond 3 metrics, but those 3, I think, are good sort of standards to start with. But certainly as we look at this, we look at the complexity of the healthcare system. So we're looking at bed capacity across the city. We're looking at emergency department visits across the city. We're looking at not just adult hospitalizations, but pediatric hospitalizations. So there are many factors that go into how we are trying to ensure that we have the capacity as a city to take care of residents who are ill.
Okay, and the community positivity rate, does that mean Boston residents? How do we come up with that if it's 7.4 now?
So that is Boston residents. So, but it does, so it's community positivity is Boston residents. It's the people who tested positive over the people who test. And that's across all of our neighborhoods. If you look on our dashboard, we also provide positivity by neighborhood. So you can look at that. You can also look at case rate by neighborhood. Again, we look at things in a lot of different ways to make sure we have the best advice to offer in regards to the pandemic.
And the people that are in the hospitals, so you come in from Rehoboth and a family of 5 comes in, they all test positive. Are those 5 people now going on the city of Boston's community positive?
No, these are Boston residents. These are Boston residents.
So community positivity is all Boston residents.
It is, that's correct.
Okay, and then, so let's talk about the, so when the press conference happened, we had, I think the number was around 1,800 people or so that were unvaxxed. Are you familiar with that? Or so let's do it by percentages.
Mm-hmm.
Press conference. What was the percentage of vaccinated city employees the day of the press conference?
I'm sorry, Councilor Baker, I don't know. I'd have to get you that information after this.
Because I think along the lines of Councilor Arroyo's questioning, you said 17% of people were vaccinated. Is that the 17% of, say, for some reason, I want to say 1,800 people. Is that 17% of the 1,800 people were vaccinated, or do we get 17% more of city of Boston residents vaccinated?
So that was a city of Boston sample that I was commenting on. I wasn't talking about our workforce. I was really talking about the city of Boston. I would have to go back, and I can do that. Look at the data that you're requesting, and I can provide you with that.
Okay. I can wait. I can wait on that. I'd like to see what the vax mandate, what the number or the percentage of people that, so if we're 95% vaccinated now, did we get a 5% bump, a 3% bump, just something like that? Don't necessarily need a whole lot of detail. So what are our metrics we're using to finally allow our city to start? And again, I guess it's not going to be a new normal. That's what everybody likes to say. We're living with this. What are the metrics when we can, as a city, can say, okay, we're at those, and at that point, when we hit those, does the passport mandate for restaurants drop? And again, this isn't even a question for you because it's a labor question, and our head labor person is not here. Does that drop? What do we do? What are the metrics when we say, okay, great, we're in a zone where we can drop that vax passport in restaurants, and we're going to start looking at our workforce differently?
So let me start out by saying that, and I just want to emphasize this, that it's not just about any 3 metrics. Certainly, we look at those as indicators of improvement. If we get below the threshold, we are really doing what I believe is a robust analysis of all the data that we have to make sure that we keep Boston residents safe. I mean, that's really our goal as a public health commission. So, we have 6 key metrics. And as I mentioned, we also look at citywide vaccination rate. We look at viral, wastewater. We look at lots of different factors. The 3 that I mentioned that tell us a lot, they give us a lot of robust information, are the percentage of ICU beds that are occupied. And that tells us a lot about our healthcare system and the pressure that's on our healthcare system. There's COVID-19 hospitalizations, which tells us some about the severity of illness, but then also it helps us understand how our healthcare system is being impacted. And those 2 pieces are incredibly important for our survival in this pandemic. And then thirdly, community positivity rate. So we want to know what's the transmission, how much COVID is there out there. And interestingly, community positivity is very highly correlated with some of the viral wastewater data, which is it's a better surveillance metric. So it's telling us a lot about what's happening in our city. And that's why those 3 metrics have been highlighted and are really the ones that we're following. But a lot of these metrics, again, they're correlated, and we're following everything because we want to be data driven. We want to make sure that we're really, doing what we think is right and giving the appropriate advice to our leadership, our administration.
Well, I mean, I think data can be manipulated any way we want to tell the story that we want, and to use the same matrix that were in place in 2020, I think is in and of itself disingenuous, because the Omicron, and it's gone through my family. We had COVID at the beginning of 21, and it came through again in December. We're all vaccinated. Only 2 of us out of 4 of us got it. So for me, the vax worked. I'm also a long timer. I had blood clots. I actually had 2 strokes in March, 2 of them, and a whole host of problems. So this is about decision making here, doctor. I want to know who was in the room when we decided to take rights away from business owners, take rights away from our workforce, and start making decisions down on mass and cast, and then point to a 2-year-old health declaration. I just find it disingenuous, and I'm not directing that at you. You're the only one that's here. My last question, Kenzie, is this data that you give us here today, is that from yesterday's, is that up to date, meaning from yesterday? How old are those numbers?
Okay, so maybe let me start by saying that, so the thresholds and the data that I'm telling you about have since been validated. We don't keep number. It wouldn't make sense for, as you wisely stated, to look at data from early on in the pandemic and then use the exact same, threshold, goals, whatever. We've actually been validating that data and correlating it to other data so that we understand exactly what these data mean in this new context of Omicron. So when I'm providing this data, I'm saying that I do believe that these numbers are still meaningful. The other piece to this is that I think that it's really important as we move forward to continue to validate our data, to continue to keep other things in mind. I don't think that it's really one of those situations where you have to look at the entire context of the pandemic and keep in mind this sort of data-driven approach, which I do feel is important. In terms of updated data, so what I gave you, like I said, we do pull up data from twice a week. And what I would say is that what I'm providing you is the most updated data that has been released. We did have some data that came in yesterday evening, and it's more in this, positive in terms of the actual numbers. Those data will be updated later today. It came in sort of, late in the evening. But what I'll tell you is that they're even better than the data that I just mentioned.
So this is not reflective of, so what the numbers we're talking about right now here today, Friday the 11th, I believe we're at, is not necessarily the most update data.
So I'm giving those to you right now. So
Okay.
yeah, so it was 7.4% community positivity. We're now at 6.9% community positivity. So again, a decrease of 3.7 or a difference, excuse me, of 1.2 percentage points. If you're talking about hospitalizations, so COVID hospitalizations, it's now 343, which is a 26% decrease. Again, that's great. And I think I mentioned to you that we had been seeing this trend, and we expect to continue to see that trend. And then in terms of occupied ICU beds, that's been fluctuating. So now we're at 90%. So it's a fluctuating sort of metric, but that's why we set a goal and we hope that it stays below that. So that's the information that I have to offer today.
So we're trending in the right direction. Thank you, Doctor. And Kenzie, my last point is I think we should be able to ask questions of our people that are labor people. We don't need to ask about contracts. I've known Tigers for 35 years. I can't ask him about his members. It doesn't seem right to me. Just a point.
Thank you, Councilor Baker. The reason for that approach is that it's not a comfortable position for the chair to tell councilors question by question what they can and can't ask. So that's why the general approach has been to say, like, blanket, we're not asking questions, but it's, like I said, I will offer an opportunity for comment after.
Yeah, please do, because this is pretty important here. There's people losing their jobs behind these numbers. We're talking about numbers and metrics, but there's people here.
Thank you, Councilor Baker. Next up is Councilor Louis-Jean, and then it'll be Councilor Worrell. Councilor Louis-Jean.
Thank you, Madam Chair. Thank you, Dr. Ojikotu, and thank you to the Labor panel for all being here. I have two questions. One is, I think around the numbers, when we talk about those hospitalized with COVID, I know there was some discussion even in the profession about what that number means. Is it people who, the thing that they're being treated for primarily when they're in the hospital is COVID, or they come to the hospital for dialysis and they have COVID? Are we making a distinction between those numbers when we're reporting those who are hospitalized with COVID? And just if you can give us your take and your opinion on that distinction. And the second question is I think, the pandemic for almost all of us caught everyone flat-footed. And so, and I'm grateful now that we're experiencing this, where we seem to be coming out of a surge, and that the mayor is having these talks with unions. I just want to make sure that we're prepared for, Omicron caught us off guard as well. And so are we prepared for another surge? Heaven forbid that be something that comes, but are we prepared in the event of that? And what do we need to do to make sure that we are prepared in the event that we get a new surge?
Thank you, Councilor Louis-Jean. I appreciate both of those questions. I think I can answer from the public health perspective on both of them. So I think you bring up a really important point. In terms of hospitalizations, are we talking about, are people hospitalized with COVID or for COVID? So we are looking at that data. When you look at people who are hospitalized for COVID, they are prescribed certain medications that we know treat COVID. So we're able to stratify and know what percentage are with or for. And it's probably around 50% are with and versus 50% for COVID. But I want to clarify a point that helps us, sort of understand why we don't divide those numbers in these metrics. So even if somebody is hospitalized with COVID, and that may just be because they were tested for surveillance reasons when they entered into the hospital, that still is problematic within our healthcare system. So those patients may wait longer for beds, and I shouldn't say may, they do wait longer for beds because these are isolation beds. They slow down the hospital process. And when I say they, I mean the hospital process slows down because we're dealing with an infectious illness. So staff, nurses, doctors are donning and doffing. So they're putting on, gear, PPE before they go into rooms. it really is something that slows down our hospital system and actually does create pressure and stress. You know, COVID in and of itself, with or for, it doesn't matter. It does create pressure and stress on our hospital system. So I know that that's been brought up, and I think it's important. I definitely, like I said, I follow that data, but I want us to understand that it still is a problem, even if somebody is incidentally found to have COVID and is in the hospital. You know, so I did want to say that. And then your other question was about preparing for the future. Was that okay? So one of the main sort of focal points of our work is to develop sort of an ongoing longer term action plan so that we know and can detect evidence of a future surge before it happens. We're working with a number of people to do that. We're also, as I mentioned, looking at our metrics, including, you know, predictive measures like viral wastewater data, so that we know in advance. And that way, as a city, we can be prepared. We can start scaling up. We can enhance our testing services. We can enhance our vaccinations, ramp it up, particularly in neighborhoods where we know have been disproportionately impacted, have suffered severe illness, death, you know, all the things that we want to protect people from, and also so that we can work with our hospital partners so that they can be prepared and increase their capacity. So it's almost like a playbook that we can follow and this is about following numbers, you know, following where things are and making sure that people, you know where we are and that the public is aware that we think a surge may be on the way. So that's absolutely an incredibly important part of the work that we're doing.
Thank you.
Thank you so much, Councillor Louis-Jean. Next will be Councillor Worrell, and then we were also joined a while back by Councillor Tanya Fernandez-Anderson, so she'll go after him. Councillor Worrell.
Thank you, Chair, and thank you, Dr. Ojikutu. I just have two questions. What are some valid medical exemptions for vaccination? And then in terms of going from yellow to red, can you walk me through like the decision process of, you know, your recommendation on when we go back and forth? Is it an increase over 2 days, 3 days, a week, in those metrics?
Mm-hmm. So thank you, Councillor Worrell. I think that those are two, you know, obviously important points. I think there probably are, you know, a whole host of valid medical exemptions. I think the one that is probably most important, well, I shouldn't say most important, it's one that we should be highlighting, is if somebody had anaphylaxis to any component of the vaccine, and we know which components have a higher sort of risk of causing anaphylaxis or any type of severe reaction. And certainly that would be, you know, a major one that would be a medical exemption. But, you know, doctors who are looking into this, they can, you know, sort of think about their individual patients and really think about it on an individual level as to what might be an exemption. And so I want to just, you know, sort of leave that a little bit open. In terms of the red, yellow, green, what I would say right now is what we have as a draft. And it's part of what I was telling Councillor Louis-Jean about a little bit of sort of what we're calling the playbook, the sort of the guide that we hope to use going forward so that we know when, you know, sort of a surge is coming and what do we do as a city, what are the recommended actions. So for instance, we might be looking for the trend. So if we see a trend, an upward trend in hospitalizations for COVID, then that may be before the 200 threshold, but it's a trend that we're seeing. And when we see a trend, we might say to ourselves, okay, we really got to get testing in. We got to increase our health communication, particularly in communities we know that are disproportionately impacted. We need to get people boosted. We need to prepare as a city with our PPE, with our masking guidance. So it's that kind of strategic way to look at things. So we're looking at trends over time and not just individual numbers per se. I hope that's helpful. And like I said, this is a draft right now. It's it's something we're working rigorously with a number of experts in like viral dynamics and infectious disease epidemiology to make sure that we're trying to give the best information to the city.
Thank you.
Thank you, Councillor Worrell. Councillor Fernandez-Anderson. I'm just checking whether her connection is good. I'll just, in the meantime, Dr. Ojikutu, just say that we will follow up from the chair on, I think specifically Councillor Baker's question about sort of what have been our numbers of vaccinations of employees since the initial announcement of the mandate. I know that we've seen those numbers reported in the press week by week, but it's been a bit haphazard in terms of like what numbers are coming out at which snapshot time. And I do think it would be helpful for the council and the committee to have on record like what that trajectory has looked like week by week over the last couple of months. So we'll send that along with any other unanswered data questions that council.
I appreciate that.
All right. I think Councillor Fernandez-Anderson is here. Councillor.
Good morning, Dr. Bisolo. How are you?
How are you?
I think you're doing an amazing job, honestly. We thank you for being here and enlightening us with your wisdom and best practices. I look forward to learning more, but I don't want to just ask questions to ask questions. I think a couple of questions that I had, Brian and Ruzi asked, and then if I have any questions, as Kinsey said, whatever reports, we'll follow up then.
Thank you, Councillor. I really appreciate it.
Thank you so much. Thank you so much. You're awesome. Thank you.
Thank you.
Thank you so much, Dr. Ojikutu. So I think we've run through all the councillors who are here. I'm mindful of the folks who are waiting to speak on our next panel. And I know that Dr. Ojikutu also has a time constraint, but if councillors have any follow-up question that they didn't get in their first round and you want to raise your hand, I'll go in order if anybody's got anything. I see Frank, I see Aaron. Okay, Councillor Murphy. Just unmute.
My first, okay. So just two other questions, follow-up questions. So as of yesterday, I understand that there were 367 BTU members that are still not vaccinated. And does that mean on Monday that they're not allowed to show up to work because we're still in the red zone? And connected to that, so just a clarification that if the city, as long as the city is still in the red zone, employees who aren't vaccinated can't show up to work. Is that correct?
So thank you, Councillor Murphy. So I can't speak to the ongoing discussions in regards to the union bargaining or agreements that were made. My testimony and my presence here is really based on the public health.
Okay, I can ask it for, yeah, that's okay. I know I only mentioned the teachers because I know they came to an agreement, but so I could ask it differently. So as long as we are in the red zone, if you're not vaccinated, it's saying that you can't show up to work, correct? As long as, if we get into the yellow zone, then they can come to work, but they have to be tested twice weekly. Is that correct?
That's, as I understand,
policy.
That's the policy. That's policy.
Okay. So I guess that answered my question then. So we will have teachers that aren't able to show up to work on Monday because we're still in the red zone. And my other question, and I'm not sure if you know this yet, because I know when Councillor Worrell asked and you said it's kind of still a work in progress, but these numbers change so quickly and we could be going based on the metrics from red to yellow and then back to red. I'm hoping we just get to green, but if not, do we have a plan in place that if, say 2 weeks from now, all the metrics are met that you have set forward and unvaccinated employees are allowed to be at work, but on, say, Wednesday morning, we see that the metrics have put us into a red zone. Do we have a plan that means these employees have to leave work because now we're not in a safe zone that was set by this mandate? I'm just thinking ahead, like logistically, like how do we then manage that as a city?
So maybe it helps to say that these metrics are a 7-day average and we would be trending them over time. So we wouldn't be putting out data that's, so one day there was just an uptick, and therefore there was, say, an uptick in these 3 metrics. And then that was what was put forth. They're actually a 7-day moving average. So they take into account previous data, current data in terms of the actual number.
So it wouldn't be as quick as like,
Right.
that we would plan that starting on.
Exactly.
One last quick thing. I know that, our best tool to fight COVID is vaccination and testing, and it's been said a lot by all my other counselors and yourself. I was under the impression that this mandate, though, was saying that city employees need to be vaccinated and that the testing option was no longer there. So has that changed, that we'll continue to have the testing option?
No. I apologize if I wasn't clear. I think what I was saying is that testing is still an important strategy. Therefore, we will continue to make testing available to our city employees, and they should use that. Absolutely. If they've been exposed, they have any questions, symptoms. That's what I meant.
It's just there for city employees and all residents.
And anybody. Absolutely.
Anyone.
Absolutely.
So you're just saying, okay. Thank you. Those are good clarifications. Thank you.
Thank you, Councilor Murphy.
Of course. Thank you.
Thank you, Councilor Murphy. We have been joined by Councilor Lydia Edwards. So I do want to just give her an opportunity to ask first round questions, and then I'll go to you, Councilor Baker, for a follow-up. Councilor Edwards?
Can you hear me?
Yes.
Sorry about that, and I apologize for being late, everyone. I'm actually just here to listen. I wanted to make sure that I was clear on, in terms of the goals of today's conversations, and so much has changed. And I think with the BTU contract kind of implementing a somewhat testing option, but new recruits cannot, or new recruits must be vaccinated. I didn't know if that's something that and this is maybe because I see that BFD 718's on and other unions are on. Is that something that you guys are looking for similarly? I'm curious about where you feel the stone walls are in terms of the contract negotiations. And I apologize, but that's where my questions were. And maybe if this has already been talked about, I can review the video. Councilor Block, I can see it in your face. But that's all.
Yeah, Councilor Edwards, we're, although we've got people in the Zoom room, we are doing 2 separate panels because of the importance of not making it look like an open negotiation session. So, but I think your question can be noted by those folks and addressed in their testimony subsequently.
Okay, fair enough. I will wait on that. Thank you.
Great, thanks so much. Councilor Baker. You're muted, Councilor Baker.
Thank you. Hi, Doctor. It's me again. Can we can we draw any parallels between the pandemic in 1918 and this one? Is it by any means following the same trajectory? Not that I've read that much on it, but it was like a 2-year thing, and there was 3 or 4 sort of different variants. Are there any parallels with 1918?
So what I would say is that I don't know. We're not at the end of this. There have been surprises, a lot of surprises here. This Omicron variant, with all of the mutations that came with it, was a bit surprising to the scientific community. The fact that it's milder is good, but I think all of us are having a hard time knowing what comes next. So it's very difficult to say that this is the same thing as, I can't really say at all if this is the same thing. I think we just have to be prepared as a city for all, potential aspects of this. And I think that's what we're trying to do, is to make sure that we are as prepared as possible in terms of our, like I said, our hospital availability, our resources. And I think that's what our goal is from the public health standpoint.
Okay. And again, I'm just having a hard time with, if we go back to around the time we had the press conference came out, I think positivities, you said, were around 27% or whatever they were, but they were high, and we all, like, nearly everybody I knew had the Omicron. Why did we, not we, because I wasn't there, why in that press conference was, okay, the positivity rate is through the roof, but we're going to wait 2 weeks before we implement all this stuff? It doesn't jive to me. And I still would like to know, and probably will never get the answer of, how was that decision made? Who was in the room? Because we had Beverly there, we had Somerville there, we had, a whole host of towns were there. And when they brought it in front of the democratic process, for lack of a better term, when they brought it to their boards, their selectmen, or someone that wasn't just a person making a decision, quite a few of them got voted down. So, like, where was this decision made? Who was in the room? And again, I'm not going to pressure you to make that decision, but that's a question that I want answered. How did you come up with this? So if the positivity rates were at 30%, why weren't we setting up field hospitals? Why weren't we doing what we did at the beginning of the pandemic, which, not to sound like a broken record, but we as a council had a daily call every day at 9 o'clock with Marty Walsh, with the person that was sitting in your role at that point, with the police, with EMS. It's just, it doesn't jive for me. So that's why I'm having a hard time. And also, if you can answer, I'm not sure you may have answered it. We hit these three matrix that we've laid out that are old matrix, 2-year-old matrix. We go down below the numbers that we want to see. What happens the next day?
You're saying what happens when we go to the yellow zone? Or with all three?
However we want to refer to it. I'm looking at the numbers. If we go down to a positivity rate of 3%, and these numbers are crashing, they were at 30%, 3-4 weeks ago. They're at in this conversation, it went down almost a point from 7.4 to 6 point whatever. So I think that those are going to come down even further. Are we going to continue to have the Vax passport? Our city workers still going to have to worry about their jobs? All these decisions that have made when we go down, and so if we start to creep up again, are unilateral decisions going to be made the same way again, without any talks to the city council? And maybe there are talks to the city council, but I know I'm not involved in them. So I'm concerned about the direction of how we're using this now for political purposes. I think the decisions were made politically, and I don't think that we're looking at it fairly. I think that Omicron is far different from what the original variant was. Again, if we had a 32% rate back in March or April, our hospitals would have been overwhelmed. We would have seen people dying. That isn't the case with this variant. So why are we treating it the same way 2 years later with this variant here? And again, a lot of that's just statement. I don't want to get you on the hot seat and have to answer any of that stuff there. Those are more statements. So I appreciate the work that you have done, and I don't envy your position being stuck in the middle here. But thank you for your commitment to the city.
Thank you, Councilor Baker.
Thank you so much, Councilor Baker. All right, I think with that, we've come to the end of Councilor questions for Dr. Ojikutu. We will next be moving on to our panel, our labor panel, and we'll hear from the representatives from a number of municipal bargaining units. As I said, we won't have direct questions for those members, but after we hear their statements, there will be an opportunity for a round of councilor statements so that people have an opportunity to react. And then if you're waiting patiently for public testimony, we will go to you after that panel. I would also just ask, I think I have one person here from BPPA where I don't have a name. So if you could just change your Zoom name so that I know who it is, that would be very helpful. And I do have a written statement from the Boston Police Superior Officers, but I think what I'll do is, in deference, I'll let the folks who are here go first, and then I'll read that into the record before we finish the panel and before councilor statements. So our order here, we're going to go first to Local 718, then we'll go to, I believe, Matthew Anderson is here from EMS BPPA. Once I get an update on the name here, I think we have another BPPA representative. Then we'll go to the co-presidents of the AFSCME 93 Council, Chris Stockbridge and Dan Moriarty, to Tom McKeever from 888, and Alyssa Catalick from AFSCME 1526. And then, as I said, I'll make sure that I read the Boston Police Superior Officer's letter into the record as well. And if I've missed anybody, I'll correct it in a minute. But I'll go first to John Soares, the president of Local 718, 718, sorry, the firefighters. John, you have the floor.
Thank you, Madam Chair. And the committee, thank you for the services. We're looking here for, thank you for allowing 718 to speak on this very important matter. Boston Firefighters Local 718, along with the fellow unions that represent the City of Boston's public safety services, have been in a prolonged dispute with the Wu administration. As you know, in August 2021, Acting Mayor Janey announced a policy for approximately 18,000 city employees. This policy provided a weekly testing option for those employees who chose not to be vaccinated. Nearly all unions signed an agreement incorporating this policy into their collective bargaining agreement. That policy was it worked successfully for three reasons. First, it helped control the spread of COVID-19 by identifying Bostonians that tested positive for the virus and quarantined in accordance to the CDC guidelines. Second, the policy provided a pool of employees who were regularly tested and therefore provided a baseline and determined trends about the virus. Third, the agreement arising from the policy acknowledged the respective collective bargaining agreement. By treating unions as partners in determining the terms of this condition of employment, the proof of success for the partnership in shown in comparing the current situation. Sorry, bear with me 1 second. When the policy was first implemented, no Local 718 member were hospitalized. Since implementation, we've had none, nor has there ever been a known case of unvaccinated member transmitting the virus on duty. Of note, in recent months, 75% of Boston firefighters placed on leave due to COVID were vaccinated. Also of note, those vaccinated employees were not subject to weekly testing and therefore could unknowingly be spreading the virus. At the time Local 718 reached this agreement with Acting Mayor Janey, Boston's COVID-19 positivity rate was nearly 10%. Today, Boston's positivity rate is under 5. For Mayor Wu to not now being terminating firefighters who served dutifully throughout the pandemic is an indication of a failed policy. Not that a public health emergency driven by data, science. Today, more than 91% of Boston firefighters are vaccinated, significantly higher than the percentage of Boston residents. We are not the problem, assuming there is a current one. Mayor Wu and the city councilors publicly supported Mayor Janey's testing policy at the time when it came out. In the collective bargaining agreement that she reached with the unions. Yet in December, Mayor Wu unilaterally revoked our negotiated agreement and unilaterally removed the testing option. Her new mandate seeks to terminate employees who do not become vaccinated. This mandate is not only heavy-handed, but disrespectful to the men and women of the Boston Fire Department who served faithfully on the front lines throughout this whole pandemic. Boston firefighters and their families continue to endure the stress of working during these chaotic times. only to be told either to become vaccinated or terminated. This was done so by the stroke of Mayor Wu's pen, without first engaging in meaningful conversations with the union labor. Recent failed discussions only reaffirmed Mayor Wu's inability to hear our members' voices. The discussion only raised more questions about the science and validity of Mayor Wu's response to the pandemic. The administration's own bargaining representatives openly questioned Mayor Wu's legal authority to issue the vaccine passport requirements for indoor spaces. The so-called Be Together policy, while the public health response to COVID-19 has generated considerable political controversy, I think we can all agree that we have successfully put Boston on the road to recovery. Federal, state, and local data all confirm this. The COVID infection rate is on the decline. Dr. Fauci, director of the National Institute of Infectious Disease, just yesterday affirmed we were near the end of this worst phase of the pandemic. More Massachusetts communities are removing the mask mandates in order to return to a sense of normalcy. Boston should do the same. We have always believed in encourage our members' choice to be vaccinated. However, we strongly believe that any vaccination policy or mandate must be bargained in good faith and our members' rights preserved. As of today, all of our attempts to settle the labor dispute has stalled. We have spent several days in long hours at the Parkman House, work in tandem with our fellow unions. Yet every time we make a proposal or agreement to the Wu's administration's proposal, the city simply ignores us or withdraws their proposal. We question Mayor Wu's willingness to negotiate in good faith with Local 718. In closing, we implore that you oppose the anti-labor position Mayor Wu has taken on this issue. On behalf of over 2,600 Local 718 members and their families, we respectfully request that you voice your support on collective bargaining and urge Mayor Wu to treat the Boston firefighters with the dignity and respect deserved by engaging in fully and meaningful with Local 718. Engaging with us fully. Know that the citizens of Boston are in need. Their firefighters will be there, as for over 300 years, since we've done for over 300 years. Thank you so much. Sorry for the jumbled thoughts. Appreciate it.
No, thank you so much, President Soares. And I think we've had a technical difficulty with the BPPA representative, so I'm going to go now to AFSCME 93. So I'll go to Dan Moriarty and then to Chris Stockbridge, also known to many of us as Tiger. And Dan, if that's the right order, great. If you and Chris want to swap, it doesn't matter to me.
Yeah, we'll swap if Chris is on. Thank you.
Chris, do you want to go first?
Thanks, Councilor. Thanks, all the attending councilors. It means a lot to see us all there trying to help us. I appreciate the efforts of the doctor. I only wish we could have done this in person. As many as my AFSCME sisters and brothers are out there doing their jobs right now on the street and don't have the benefits of Zoom and still have to go out and perform their duties every day. As I listened to the councilors early on, I heard Councilor Flynn ask a question about tracking City of Boston employees and their long-term conditions. And I mean, the simple answer is no. I mean, as an employee who had COVID in the very beginning, if not one of the very first City of Boston employees, I still have conditions with the long-term care that's going to need to be probably addressed, between still losing my taste and smell as well as breathing heavily at times. Councilor Mejia asked if we were ever offered any kind of mental therapy or anything like that. The answer is also no. In most cases, we were told, hurry up, get back to work. For myself personally, I lost a mother to COVID 6 days after losing a mother to COVID. I had a brother in a coma with COVID. He was up in St. Elizabeth's Hospital, and I happened to drive by just to say a little prayer to myself. And I was called by my superiors and warned that, I could be terminated if I go near the hospital. I mean, these aren't ways to treat your employees. And I mean, a lot of what I heard all the other councilors speak of, I agree with. Councilor Edwards asked what the stonewalls are. What the stonewalls are in the collective bargaining process is no president or union member ever wants to bring back an agreement that's going to terminate a fellow member. We're not here to get our brothers and sisters fired. We're here to come back with a deal that works for everybody. And we were able to do that under Mayor Janey. We respectfully went to the table. We worked out a deal that worked for everybody. And we wanted that deal honored. And if the numbers were so high, and for full disclosure, I'm vaccinated, I'm boosted, but it was my choice. It was a choice that I made. And with conditions of employment, they need to be negotiated at the table through collective bargaining. And so far, the collective bargaining rights have just been run over. A lot of times, city employees are getting emails about issues that we're supposed to be bargaining at the table, but they're calling us saying that emails are going out by administrations asking us what's going on. And then in a lot of cases, we're there to pick up the pieces. And then we have to start the process to reach out to the administrations to say, what's going on? Why aren't we being notified first? Why aren't we working this out? None of us are anti-vaxxers. We want to protect ourselves as well. We want to protect our colleagues. We want to protect the public that we have to deal with and interface with every day when we're out there. I've worked for the city of Boston for 32 years. The last thing I want on my conscience is that I made somebody sick or that I made somebody unable to perform their own duties. But we're looking for a partnership, and we're just getting, it's our way or the highway, and that's just unacceptable. As many politicians that have come before us and asked us for our support, the number one question that we always ask is, how do you feel about collective bargaining? And the answers always are, we love collective bargaining and it won't work without it. Well, it's a plain and simple thing is collective bargaining has to work, and we can't just use a pandemic as a reason to stomple on the collective bargaining rights of all of us and our members and our sisters and brothers across the entire city of Boston and the United States of America, for that matter. We still have to sit and create a plan that works for everybody. One thing that everyone has to realize is, as union leaders, we don't just represent the vaccinated, we also represent the unvaccinated. And we have to do our jobs to make sure that accommodations are made for all. And there's plenty of leeway to make sure that everybody can continue working and we can keep the city safe. I echo everything that Brother Soar said. And, the unions are doing all we can to come back with fair deals for our members. And we ask that the city council stand with us. We ask that the mayor stand with us. And we ask that you all continue, or at least try to continue. And I'm not asking, I'm saying we want our rights respected and carried out. And I tell you now that everybody that's come in front of us should be standing with us now to make sure that a two-sided, properly negotiated deal comes through, and that no members are just thrown out the door and can lose their livelihood after having a great career with the city of Boston. It's not fair. And I just don't understand how we got this far in the process. That's what I have to say. I appreciate everybody's time, and I thank you.
Thank you so much, Tiger. Next up, Dan Moriarty, also co-president of AFSCME 93 Council.
Thank you, Councilor Bach, and thank all the councilors for putting this together. Thank you, Frank and Aaron, for testifying. My name is Dan Moriarty. I'm president of AFSCME Local 944, which represents police and fire civilians, mechanics, custodians, and clerical workers. So just to echo what Chris said, we're not anti-vax. We have a very high vaccination rate in AFSCME, probably one of the highest in the city, but we are pro-collective bargaining. And I want, one question I wanted to ask is, what happened to collective bargaining? To an administration that ran on such a progressive agenda, to throw collective bargaining out the window is against all of those policies and all of those beliefs. So what we have here is, like Chris said, is yes, we have a high number of vaccinated people, but we also have a very small percentage of unvaccinated that still deserve a voice in the workforce. And to completely throw out an agreement that was signed in black and white, legally binding, is disheartening and discouraging, to say the least. It's not pro-union, it's not progressive by any stretch. And I mean, for that, to bring that back to our membership and is difficult to say the least. As far as, you know, the plan working prior to the mandate, like President Soar said from Local 718, those metrics worked. The testing once a week was working. The numbers were on the uptick, and now they're coming down. So for that to work during that period of time and not work now, it doesn't make any statistical sense whatsoever. But yeah, we're you know, our members have been out there every day. We couldn't work from home. I'm in my garage right now in Jamaica Plain fixing a police car. We were there every day for the administration, for the people of Boston, the mechanics, Pox, Tigers people. So what we're here to say is that we believe in collective bargaining, and we believe the administration should as well. Thank you.
Thank you so much, Dan. Next up, Tom McKeever from Local 888. Tom?
Good morning, Madam Chair, and good morning, City Council councilors and Councilor Aaron Murphy, committee members and distinguished guests. At this time, I'd like to thank Councilor Bach and Aaron Murphy for their continuing to create an opportunity for organized labor to be heard and creating this panel. We look forward to other opportunities in the future to work collaboratively to enhance relationships between organized labor and the city of Boston. Existing labor agreements were in place related to the COVID-19 prior to the vaccine mandate. We wish that additional COVID time be built in, preferably 10 days of COVID time, additional wellness days, and testing options for those that require it. Local 888 believes all workers and all unions should be heard and represented and that is our daily model. We support our union brothers and sisters citywide from other locals, both public sector and public safety. We wish to work with the city unions in a continued collaborative nature as well. We wish to thank them all for their steadfast efforts through this international pandemic. We have represented all membership, in our opinion, to the city of Boston throughout the pandemic in the name of fair representation. We believe the due process should take place in good faith, bargaining sessions between the city of Boston and all unions. We look forward to the opportunity to maintain and bargain a fair contract. We believe that any information requested of the mayor and her administration should be furnished to the city council in order for the city council to do their jobs and generate necessary discovery that is so important for fair representation. I thank you on behalf of SEIU Local 888, and I echo the sentiments of our brothers in labor. Union leaders are here to keep our members gainfully employed. Let's not stop having this conversation, or let's stop having the conversation of progressive discipline and termination, and let's march on in a positive and productive manner. I thank you for your time, and thank you for the opportunity.
Thank you so much, Tom. Next up is Alyssa Catalick, President of AFSCME 1526. Alyssa?
Great, thank you. Good morning, everybody, and thank you for holding this hearing, Chairman and the rest of the panel, both the prior panel and this panel. I know there's a fine line at this hearing. I believe bargaining does belong at the table and not at the City Council. That said, it is the council's responsibility to make sure the city abides by the law as it governs collective bargaining. I represent AFSCME 1526, the library assistants, the clerical workers, and the trade workers at the Boston Public Library. And we appreciated the willingness of the administration to protect our workers, both vaccinated and unvaccinated, and we were able to keep their jobs. When this new mandate came out, many workers got vaccinated while others followed the rules and got tested weekly. They uploaded their results. Even when the portal didn't work, they sent them to their HR managers, they sent them to their supervisors because they wanted to make sure they were following the rules. Here, we haven't had any recent workplace clusters, and our members have been on the front lines throughout this pandemic and have shown up every day to serve the public. I, as did many other city unions that you've heard from today, entered into a good faith agreement with the city in October that protected our members' jobs and respected their personal decisions. And that should have withstood any surges or changes to metrics. Having a testing mandate allowed employees to continue to work while keeping their coworkers and the members of the public safe. We're talking about real people here, not just numbers. We are potentially going to lose employees who support our communities both on and off the job. And the people who we might be losing, many of whom identify as people of color. My members are part of the communities beyond their workplace, and we should be celebrating and encouraging that. Our issue with this is how the policy was handled. Announcing a change to the policy without meeting with the unions is bad faith. If you want to make changes to a policy or a mandate, you need to do it the right way. You need to notice the unions first, set dates, and sit down and bargain. We remain willing to sit down with OLR to bargain and figure out ways to protect our members and the public without our members losing their jobs. We don't expect to read about it in the papers or at a press conference before we get noticed of anything that's changing. When we were able to sit down with the city, we asked why they felt changing their vaccine for continued employment. We weren't given any concrete reasons for this change. We asked for data about COVID cases specific to the unvaccinated pool, and were told that they could not provide that data. We asked why the contractors who work within our buildings on a regular basis are being held to a different standard and got no response. And that list goes on. When we asked for additional meetings, we were denied. When we provided data to support our counter proposals, the city refused to engage. The lack of communication between the city and the unions is what brought us here today. Following these rules and means working together for change and implementation, something the city hasn't even been able to do, and they can't even enforce what they put out, such as responding to accommodation requests in a timely fashion. And when OHR shared the names and email addresses of City of Boston employees who tested positive and who are unvaccinated, it violated their privacy and our agreement from October. This is one of the things we kept bringing up at the table, our concern about privacy. The city expects us to meet with them and trust that they will abide by mutually negotiated agreements now and in the future. How can we do that when that trust has been eroded? At the BPL, we do not discriminate. Our doors are open and free to all. We are constantly reminding patrons to put on or pull up their masks. Our members regularly, closely engage with the public. We do not require vaccination or proof to enter our buildings, so why should City of Boston employees be treated any differently? We talk about reducing risk. My members don't deserve to have the public verbally abusing them, refusing to leave, and making recordings of their protests about these mandates, as occurred last weekend and again yesterday at one of our branches. The BPD should be empowered to remove these individuals if they're in violation of our policy. This failure is increasing the risk to my members, not due to testing, not due to a vaccine mandate, but due to a lack of enforcement of even the basic level of mask wearing and asking people to leave. This failure to bargain and failure to support the city employees make my members feel they are not valued by this administration. I stand with my fellow brothers and sisters across the unions. This is not how your employees who have continued to serve every day during this pandemic should be treated. This union is open to good faith bargaining at the table and trying to reach an agreement with the city that protects our workers and the public. And I certainly hope the city feels the same way. I thank you for your time.
Thank you so much, Alyssa. I want to check, I think, President Calderon, we've made it possible for you to unmute. If you can test that now. All right. We've been having technical difficulty with the BPPA. I'll just ask that they submit written testimony if we're not able to hear the spoken testimony. I will go now. We've heard from all of our other panelists who are here. I am going to read this letter from the Boston Police Superior Officers Federation. So I'll read that into the record, and then For counselors, I'll just remind folks that I will give everybody an opportunity to make comments once I finish reading the letter. And then we will go to public testimony. I just really want to thank all the labor representatives who just spoke to us, and apologize again for the ways in which the charter makes this more rigid and formal than our kind of normal exchanges. All right, February 10th, 2022, to the Boston City Council. Thank you, Madam Chair and the Committee on City Services and Innovation Technology for allowing the Boston Police Superior Officers Federation to address this important topic. We share the concerns of fellow unions about the mayor's disrespect for collective bargaining and her disregard for the sacrifices made of our members during this pandemic. It is irresponsible to suggest that public safety has ever shirked its dedication to the public. When the city shut down and forced employees to stay home, Boston Police and Fire continued to report to work. While many residents distanced themselves from neighbors, friends, and coworkers for fear of the unknown, Boston Police and Fire continued to work in the danger zone. We were not allowed the luxuries afforded to all other city employees, such as flexible work schedules, telecommuting, virtual workspaces, or paid leave to care for family members during the pandemic. Moreover, the city often forced us to work in 2020 and 2021. Police and fire experienced unprecedented amounts of forced overtime and cancellation of scheduled days off. Still, we served. When the vaccination was first made available to first responders in early 2020, Mayor Walsh and Commissioner Gross respected collective bargaining by encouraging but not forcing first responders to become vaccinated. Many stepped up. When Acting Mayor Janey announced the first ever COVID-19 testing policy in August 2021, she adopted the successful model of Vermont and that was ultimately adopted by Labor Secretary Marty Walsh, vaccination or weekly testing. We had several meetings about this policy and finally reached agreement on December 7th with Mayor Wu. When we signed the agreement, the city never suggested that the policy or our MOA was under review. The positivity rate at the time we executed was 6.7% if you exclude colleges, or 2.3% if you include colleges. Just 10 days later, Mayor Wu changed the policy without so much as a phone call first to us. The positivity rate was the same when she changed the policy as when she signed our MOA. But it is not merely that Mayor Wu changed the policy and ignored our MOA that has demoralized public safety servants. It is the manner in which we have been treated. The city gave just 25 days notice of the change and then refused to meet with us until 1 week before the mandate went into effect. When we finally met, the city did not respond or address our concerns. The city showed up to a mediation the next week without any authority to settle. The city has given shifting reasons for issuing the mandate for employees, which was implemented at the same time Mayor Wu's passport requirement for indoor spaces was implemented. Of the 6 metrics examined by the BPHC, the city cited only 2 of them. Only one of those metrics, positivity, exceeded the stated threshold, and then only if you excluded testing by colleges. We asked the city to explain the metrics guiding this policy, and the city could not explain. We asked the city for information and has refused to provide that to us. We have had several marathon sessions with the city and other unions to settle this dispute. It is clear to us that the mayor's decisions are guided by political science rather than science. For instance, when we met, the city could not articulate any metrics used to guide when it would rescind the policy about the surge. It was only this week when the city finally claimed 3 metrics will dictate its decision. Plus, all the evidence indicates that the surge has ended. Positivity rates, hospitalizations, and wastewater data all demonstrate that the threat has abated. The city's claims that unvaccinated employees place the public at risk is absurd. Remember, our members worked tirelessly through the pandemic without any additional pay or benefits. Everybody knows that we kept the public out of harm's way rather than placing them in it. Plus, the mayor deliberately forced unvaccinated employees to work during the worst of the surge when positivity rates approach 30%. You can only believe that unvaccinated employees present a risk to public health if you believe that Mayor Wu deliberately jeopardized the health and safety of Boston by forcing unvaccinated employees to keep working in December and January. Plus, when the appeals court granted a temporary stay of the policy, it applied only to police detectives and superior officers and firefighters. Yet Mayor Wu chose to extend this stay to all 18,000 city employees. That does not seem to be a decision guided by public health or science. Our major sticking point during negotiations has been what to do about unvaccinated employees right now. Mayor Wu says she wants to put them out of work, even though we're at the end of the surge and there is no evidence that public health worsened. At the same time, the mayor's deal with the Boston teachers allows her to remove nearly 400 unvaccinated BPS staff right now. Mayor Wu won't do it, thus suggesting her obsession with the metrics is just an illusion. That's the end of the written testimony from the Boston Police Superior Officers Federation. I just am going to check one more time that I don't have the BPPA. Okay. So now we will go to counselor statements and then and then we'll go to public testimony. And I do just want to thank the folks who are here on to give public testimony for your patience. First up, Councillor Murphy.
Thank you. And thank you to all of the unions who were here today and taking these few hours out of your busy day to attend this meeting and share your concerns. What I heard over and over again from all of you and was reminded is that your employees have been showing up to work every day, keeping the city safe, moving it forward. You did not have the privilege of Zoom or to work remotely, and that is not being, listened to right now. So thank you for all that you do. And I'm happy that you've had this opportunity today to share your concerns with the council, and knowing that going forward that you're back to the table and that the administration is going to come back with you to talk through this negotiations that we need to move forward, and we need to have your voices heard. So thank you.
Thank you, Councillor Murphy. Next up, President Flynn. And then it will be Councillor Arroyo. President Flynn.
Thank you. Thank you, Councilor Block, and thank you for chairing this, and to Councilor Murphy for sponsoring the hearing. I want to thank the panelists for being here, the city employees that have worked during the pandemic, especially during these last 2 years. COVID-19 pandemic has been a terrible time for our city and country. And it brought a great division, not only here in Boston and Massachusetts, but across the country. But having said that, it's still critical that we work together during this pandemic to protect ourselves and families, in the residents, in the neighbors we serve as well. Data has shown that vaccines and boosters have been extremely effective. I continue to encourage all my neighbors to get vaccinated, and I'll continue to work with the city administration and encourage them to continue to work with city employees and with city unions to be at the bargaining table. Collective bargaining has always been a critical part of worker and management issues, and collective bargaining is something I strongly support. I have a strong record of support of organized labor on the Boston City Council, and I'll match that with anyone's record, to be honest with you. Having said that, these are difficult times in our city, but I still think if we work together, we go back to the bargaining table and sit down in good faith, I think there can be a compromise here. Thank you, Councilor Barker.
Thank you so much, Councillor Flynn. Next up is Councillor Arroyo, and then it will be, sorry, I just lost my list. After Councillor Arroyo, it'll be Councillor Baker. Councillor Arroyo.
Thank you, Madam Chair. Thank you, everybody who participated. I'm going to keep my comments short, just because I know we have folks waiting to give public comment, and I'm interested in hearing from them. Thank you, Madam Chair.
Thank you, Councillor Arroyo. Councillor Baker, and then it'll be Councillor Louis-Jean, and then Councillor Worrell. Councillor Baker.
Thank you, Madam Chair. I'd like to, if it's okay, get a sense of, from the people that spoke, what are their numbers we're talking at? Like, so maybe Tiger can tell us what he's talking. John can, so if we can, if you can call them out, Madam Chair, and ask them what the numbers of their unit that we're talking about.
I think probably the best way for us to do that would be so I can make that a pair with the information request of the same way we're asking the admin. We can ask the union, but we can also ask the admin for that info request broken down by unit, because they should have that data. So I'm happy to get it that way. I think that's probably the best way for us to get that.
Oh, okay, good. That's fair enough. And also, Alyssa made a point about what I think was a HIPAA violation there with the city sending out people's people's health information. I kind of heard about that, but I didn't, I never really saw very much of it. I'd like to get, and again, she's not here, labor relations, we're in the labor committee, she's not here. I'd like to get an explanation from her. What's the next steps on that? If we, you know, is there any sort of, you know, what's our next action there? And again, not looking to get somebody fired, but why did that happen? How did that happen? So that's two. I had a question around something else here. Can't really think of it, but the continuing theme that we're seeing here, Madam Chair, is the fact that this administration refuses to have a conversation here. There's no conversations, and that's a problem. There was an agreement in place. We're making decisions about people's life, and we're just talking about labor. We're just talking about our workforce here today, but I can't say it enough about the restaurants and small businesses that are being affected. It's affecting every part of our lives. I think it's time to figure out when we're able to normalize. Where's the leadership that's going to tell us, okay, Boston's coming out of this, we're going to be healthy, and this is what we should start doing. I'm looking for some leadership here. I'm looking for a partnership, and we don't have it. The unions don't have it. Me as a city councilor, someone that represents 75,000 people, I feel like I'm in the dark. I feel like I'm being negligent in my job because I'm unable to move the needle on this. I don't think that the data backs up what we're doing here. I think it's time to lift some of the vax passport for restaurants, and I think it's time to come to an agreement with these unions. In a time where we're talking about getting rid of people, the people that were out on the streets when we were all home on our couches, the police, the fire, Tigers group, code enforcement, they were out there. Dan Moriarty, he didn't have a chance to do COVID. There's legislation at the State House that will allow people to put time on the backside of their retirement. We should be talking about how we reward the people that were boots on the ground during this pandemic. And that talks about people that are in the transportation department, the people that were collecting money for the tickets, they were in their boots. The people that were collecting taxes, they were in their boots. The people that were still pumping out our birth certificates and marriage certificates, they were all in the office. And we're talking about getting rid of them? What have we become? We should be looking at how we reward these people, not how we hurt them. And I would like an answer about what we're doing about that HIPAA violation. And I would like some real numbers on these and how far this needle has moved with the city workforce. If we had 1,800 people, we were 90 whatever percent vaccinated. Did this move 1%, 2%? Is all this angst in everybody's life here, is it all worth it? At the end of the day, is it worth it for political points, for political talking points? That's what I think it's about, because we're still unable to figure out how we made these decisions. Who was in the room? Who made this decision for the entire city of Boston? Who made the decision? That's my question. Thank you.
Thank you, Councilor Baker. And yes, we'll add the HIPAA follow-up question in the information request. And also the question you're asking about decision procedure. Councilor Louis-Jean is next, and then it'll be Councilor Worrell, and then Councilor Fernandez-Anderson. Councilor Louis-Jean.
Yes, I just want to say thanks again to the labor panel. As many have said, we are living in very unprecedented times that none of us has lived through a pandemic before. And so I encourage the right of us all to be able to work in safe workplaces, and grateful for the work that has been done, and encouraged by the fact that the mayor is having ongoing conversations with labor. So I think that, to Frank's point, I think that those conversations are happening. And so I'd like to know, if we could get information about when they happen, I'd be grateful for that, so that we, the city council, can be kept abreast. I know that, the negotiations are between the mayor and the unions. And so city council doesn't really have a official role, but as long as we are kept up to date in terms of what, when those conversations happen and what occurs, I'd be grateful. Thank you.
Thank you, Councilor Lujan. Yeah, I'm happy to request of the administration information on bargaining sessions held. I would hope we could get that information. I don't know what the legal history of whether that itself is the thing that we get to know or not. But I agree with you that it seems reasonable to me, and it would help the council. I think the whole council. I think, and this I should say has come up on a number of occasions before. I think we live in sort of inherent frustration with 17G because we care quite a lot about our city workers and the departments implementing policies. And I think in many ways would love to be at that table, but happy to get whatever information we kind of can without being inside of the negotiations. So thank you, Councillor. Next up, Councillor Worrell, and then Councillor Tanya Fernandez-Anderson.
Yes, I want to thank the Labor panel for their dedication and commitment to our great city of Boston. I am hopeful that through the communication that we can come to an agreement, and I'm looking forward to hearing the rest of the public testimony. So thank you.
Thank you, Councillor Worrell. Councillor Fernandez-Anderson.
Thank you, Madam Chair. Well, this is it's not easy, right? I mean, I think it's imperative that we retain a culture of civility, and I really have a deep respect for the diversity of viewpoints here as it pertains to this such a divisive issue. I am engaged in this balancing act, and hopefully that the public health and all of us, I really believe that we must be able to balance with particular positions of individuals. And I offer the utmost respect for all of the dedication of our public workers, many of whom have worked diligently for decades, right? Centuries even, with generations before them. I think, they shouldn't be vilified for having opposing positions, and I really do, of course, respect the bargaining, collective bargaining, or caricature for personal decisions that they make. But however, I want to state that there's preponderance of data that we have that demonstrated that vaccines act significantly, or at least lessen to the chances that someone will contract COVID. So some of these protesting views, I think, sometimes create this position that people are anti-vaxxing, and I really respect the fact that we can come to the table and have a civil discussion, basically. So I just want to thank everyone here, and I look forward to the conversation. I agree with both Council Chairwoman and Council Lujan that we would like to keep abreast of any types of bargaining or decision making process that takes place in the administration, and hopefully that we can continue to create this platform to further this discussion. Thank you.
Great. Thank you so much, Councillor Fernandez-Anderson. Before I go to public testimony, I see Councillor Murphy on the screen, and since it is her hearing, I did want to give her the courtesy of a last word if she'd like one. And then I did see a couple of our labor representatives' hands go back up. So what I'll do there.
I want to go to them first, and then I can.
I think actually because of this whole order thing, because It's not supposed to be. But I will take. So what we'll do is if you make a comment, and then we'll move to public testimony. But what I'll do is I'll let the labor reps get another word in as the sort of start of public testimony. That makes sense.
Yeah, I'll just say again, thank you everyone for your testimony and support today. I called this hearing to provide an opportunity for all our voices to be heard and to have information given in this constructive way. So thank you all for showing up and supporting this process. And I look forward to continuing. I know a lot of councilors now have good, questions. With more information, we now have more questions about are we still at the table? Are we moving forward? And how can we support you? So thank you very much for all of your input.
Great. Thank you, Councilor Murphy. I'm now going to go to public testimony, but as I said, I'll take as the start of public testimony just further comments from our labor representatives who are here. So I think in order of the hands that I saw go up, I'll go to Tom at 888, and then to Tiger, and then to President Soros. And then just so that folks who are here know that you're on deck, I've got Ben Siegel, I've got Dana Dipolto, I've got Jonathan Cohn, John Daly, Janet Slobin, Naporsha Patterson, Laurel Radwin. And then there's a few people, Anthony Strong, Mr. Livingstone, and Alex Stein, who I have signed up, who I don't see yet. And then there's a couple more people. I've just got to make sure that you're signed up to testify. If you are watching this and you realize that you want to testify and you haven't signed up, I'm just going to remind you to email ccc.csit@boston.gov. So ccc.csit@boston.gov with your full name and your neighborhood or town if you live outside of Boston. And then just make sure that your Zoom name matches that name that you've given us so that we know that it's you. That'd be great. Now, okay, Tom, we'll start public testimony with you.
Thanks again, Madam Chair. I just wanted to mention that the City of Boston received $480 million by way of ARPA money, American Rescue Relief funds, and it's been communicated to this office that half of that money has been utilized in other pieces. We've done our due diligence in this office, and it's been always communicated that the ARPA money was meant for the essential as well as the non-essential and workers that worked through the worst period in history. It's also meant to uplift small business owners, and I hope that we can have again. It was supposed to be delivered for one-time bonuses or one-time monies for one-time bonuses, but the Department of Treasury has released a final rule, and the international is communicating to us that we can have the conversations about wage increases, longevity pieces, as well as retirement. And we would, with the remaining money that the city has by way of ARPA, we're hoping to have conversations with city councilors to help us in our endeavors in main table bargaining for our members. We believe, again, with the trying times with everyone living through the pandemic, that our members certainly deserve ARPA money for what, all of their services that they provided. That's all I have. Thank you.
Great, thank you, Tom. And I'll just say my other hat is as chair of the COVID Recovery Committee, and we are going to have a hearing. It's in the middle of being scheduled about the sort of overall spending of the city ARPA money. So we'll make sure that the information on that gets to you once it's scheduled. All right, next up, Tiger.
Thanks again, but I do want to say one thing that should be said is at our negotiation sessions, I invite all the councilors that would like to come in and sit in and actually sit at the table so you can hear what goes on. And I would also like to invite the mayor to come sit across from us, as previous administrations have done when times get tough like this. Mayor Menino came and sat at the table across from us. We had Marty Walsh come sit across the table from us, and even acting Mayor Kim Janey came and sat with us. You need to hear it from us and not for the representatives you send to the table, because you need this information firsthand. And I invite you all to participate. Thank you.
Thank you, Tiger. President Soros.
Thank you again. We're hoping that we could get to do this in person next week if we can. That was our original goal. But I want to thank Councilor Murphy and Councilor Baker for their help today. As far as Councilor Louis Chen, she made the comment of working with the Mayor Wu. We have not had a solid meeting where we have presented 4 proposals to them, yet to receive one back. So those talks are not working in a direction that good faith bargaining works in. So that is an issue there for us. So I thank you for your time. Thank you for having this today.
Thank you so much, John. President Kedelic.
Thank you. And again, I just want to thank all the counselors and for calling this hearing today and listening to us. I also want to just piggyback on what Tom was talking about with the monies, and that some of the things that we have raised during this pandemic are the state of our buildings. And when we've offered across, the air exchange rates are supposed to be 6 or higher. Many of our buildings, not just at BPL, but across the city, do not have those protections, do not have good filtration, do not have good air quality, don't have systems in place. Many of our buildings are old. So when we are talking about all of this, both putting our employees at risk and how to protect our employees, I think that also needs to be part of the conversation. Again, I thank you for your time today.
Great. Thank you, Alyssa. All right. Next up, we've got, sorry, just getting back to my list, Ben Siegel. And after Ben, it'll be Dana. So I'm just going to promote you through. Just I'll remind folks, so we do ask people to state their name and residence or affiliation, your neighborhood or town is fine. And then we ask people to keep their comments to 2 minutes, just so we can get through everybody who's on the list. If you hit that 2-minute mark, you'll see my gavel go up as a visual sign that it's time to finish. 1 moment. And so then I just ask you to conclude your remarks. I also just want to add, and Councilor Baker, I see you, I'll come to you in a sec. Just a reminder to everybody that that it's important to, we make public testimony available for everyone to express their views. We know people have passionate views on this topic, and they're welcome to express them here. This is a kind of FCC guided public broadcast, so we do ask that people keep all language appropriate, and you will be cut off if you're not. Before I go to public testimony, I saw a hand up from Councilor Baker, so I just wanted to let him say a word.
Thank you, Madam Chair. Can I make one more suggestion that anybody that's giving testimony show their face on camera also?
Sure. I won't require that, because I know that there are some people who don't have the video feature, but I would say that, to Councilor Baker's point, I think, and to the point that's been raised about how these do or don't model in-person hearing, that it's always great if we can see the person who's speaking.
Thank you, Madam Chair.
Thanks so much. All right, going now to Ben Siegel. Ben, you have the floor.
Good afternoon. I appreciate the opportunity to testify. My name is Ben Siegel. I'm a retired pediatrician, 47 years at Boston Medical Center, professor of pediatrics at Boston University, born in Boston, and have lived in the South End for more than 50 years. I support Mayor Wu's policy that mandates for vaccination for city workers pending changes in public health data is important. The science is there. We are in a public health crisis that can only be solved by universal vaccinations, which are safe and effective and limit the spread of the COVID virus, including Delta and Omicron variants. And I repeat that, limit the spread of those viruses. Government mandates are effective in addressing a public health emergency. State law supports mandates in a public health emergency. The Boston City Charter, Section 42, has language which notes extreme emergency involving the health and safety of the people are important. So a little bit of history. George Washington commanded his troops to be vaccinated against smallpox in 1777. In 1905, the Supreme Court of the United States, in the case of Jacobson versus Massachusetts, upheld that Massachusetts could mandate vaccinations for all people. Justice John Marshall Hyland noted, according to settled principle, the power of the state must be held to embrace at least such reasonable regulations established directly by legislative enactment as will protect the public health and the public safety. And further explained, there are manifold restraints to which every person is necessarily subject for the common good. It is the moral duty of every citizen and public employee in a public health crisis to mitigate this crisis. Delay in vaccination can only lead to more illness and death, especially for children who cannot get vaccinated. Thank you.
Thank you, Ben. Next up is Dana DePilto. Dana?
Hi, good afternoon. My name is Dana DePelto. I live at 111 Claiborne Street. Madam Chair, thanks so much for allowing public testimony. I will note for the record that it's disappointing the public still has to continue to sit until the end of a hearing to voice concern, as this is not our full-time job to sit and listen to ramblings that we hear day in and day out of nothing necessarily that has changed. I do want to note, I'm just surprised, aside from Councillor Murphy and Councillor Baker, who I do support on this hearing, that there should be no difference in the mandates that were blocked by the United States Supreme Court against OSHA back in January, that they were requiring vaccine mandates that would have impacted 80 million people. So although we are only talking close to 400 representatives of the city of Boston, I think we need to stop looking at the underserved community and start looking at those that actually serve our community. The metrics that are being used, and the Doctor of Public Health has mentioned it prior, is most of which are from an underserved community. And I do speak frankly, and I do apologize, that's not necessarily my problem. That seems to be a problem in respect to their own personal health and their own decisions. So that should not be a conversation that should be part of our vaccine mandate requirements. And I do want to respect the unions for their historical history of bargaining. And I ask all the city councilors listening that they are not asking for much. They are only asking to respect the weekly testing. And for anyone sitting on this meeting thinking that that's too much is only thinking of their personal politics. Thanks.
Thank you so much, Dana. Next up is Jonathan. Jonathan, I just was trying to bring you over. And then after Jonathan, it will be John Daly.
Okay, can you, sorry about that. I'm on two different Zooms and I missed the, missed the first notice. Is it okay? Is it okay to start? Okay, awesome. Thank you, Councilor Bach, for running this today, and thank you for all of the councilors present. Name is Jonathan Cohn, testifying in a personal capacity today. I'm a resident of the Fenway, wear many hats. Wanted to thank the city for the city's work on the COVID crisis, really from the start. I think that the city's work has made Boston kind of a leader compared to a number of other states on issues around public health. Wanted to just make a few quick points. Wanted to stress one fact for that there's no major religion that opposes COVID vaccination. And I think is an important thing whenever talking about mandates, that even Christian Science, and that they have I live right across from their large plaza. Even the Church of Christian Science encourages its members to obey vaccination requirements. So I think that's something important to think in mind when thinking about people who, at this point, are resisting vaccination, that the religious grounds really aren't there for it, and that medical exemptions are always respected. And one of the important reasons for maintaining high vaccination rates across is so that those who have those medical reasons for not being vaccinated can go without being vaccinated. I think it's kind of during the COVID crisis, we've seen kind of that fundamental ethos of public health as being one of solidarity, of recognizing that everybody's health is ultimately interconnected, and that kind of abiding by public health measures and kind of getting vaccinated is a way of showing solidarity with those around you at the workplace, out in the community, and all of the spaces in which we operate. So I think I commend the city for taking strong action. I also want to commend Mayor Wu for negotiating in good faith, as I think that the Beach U development show that kind of showed a willingness to be responsive to as situations kind of change and as data changes, since that there can be a kind of a responsiveness to that. But it is important, especially one point comes to mind is that people that there are so many ways in which people will interface with the city on a day-to-day basis. And some of those are a choice and some of those aren't a choice of interfacing with the city. So it's something that is somewhat different when it comes to, let's say, going to a restaurant that you can simply choose not to do. So public health becomes even more important when it comes to engaging with the public, as well as protecting the health of all of the members of the city workforce because of the great work they do. And just want to commend the great work that so many of the city workers who have been our essential workers have done during the COVID pandemic.
Thank you, Jonathan. Next up is John Daly, and then it'll be Janet Slovin. John, you have the floor.
Thank you, Madam Chair. Thank you all City Council members. A special thanks to you, Chair Bach. Councilor Baker and Murphy, your initiative is duly noted. I'm here to say the city's behind you and we support your efforts. My name's John Daly, teacher in Roxbury. I represent the Teachers Association of the Boston First Responders United. We're a civil rights organization founded to protect all workers' civil rights. I know today's hearing is primarily focused on the labor rights and contractual rights of workers, but we believe the civil rights are labor rights and they cannot be separated. To that end, I'd just like to submit some letters from a diverse group of teachers. And I would like to read some excerpts from 3 of those letters to you now. First excerpt is from Ms. Mozzarella. She writes, now our supervisors spend their time trying to figure out staffing as some of their long-serving and most valuable staff members are forced out of their jobs. In a year when staffing was already very challenging, your mandate was taken the challenge to a whole new level. And the gaping wound that will be created by this mandate has the blood of so many of our Black and brown educators flowing from it. Young and experienced women and men will be leaving our system as they decide to remain true to their thoughtful and very personal healthcare decision. It is ironic as we enter Black History Month and we are told that Black Lives Matter, or should it be that only vaccinated Black Lives Matter? The second one is written by Deirdre Dostow. Simply, how will we let our children, special ed teacher, mind you, how will we let your children that we are being fired over religious and disability discrimination? How will we explain to our students so many educators of color are being terminated when we devote ourselves to teaching our students that they can achieve their dreams regardless of race, religion, and disability? Another piece from Laura Ross. This was sent earlier to the school committee. The MOU is controversial at the very least. In a regularly scheduled meeting, we opened on a closed union meeting with the mayor. This is at a BTU meeting with the mayor, who respectfully is not a dues-paying member. We found this odd in a closed BTU meeting. Recently, the Globe reported that, I believe it was the Globe, that that 84%, this MOU was approved by 84% of its union members. But listen, there were only 3% of the union there. We're 8,500 strong, less than 300 were on that call. You know, teachers want to exercise their freedom of healthcare choices are being labeled as unvalidated. We as a school district are attempting to move forward or towards inclusivity and bringing down barriers. This MOU labels a whole group of people based on their healthcare choices and then requires them to be segregated using their own sick time based on quote unquote science. This is a month where we remember and teach about the struggle to end segregation. In closing, the dubious and equitable tentative agreement that the union, teachers union, and Mayor Wu have entered into fundamentally usurps not only workers' rights, but it also usurps the legislative rights of the city council. So again, thank you for hearing us.
Thank you so much, John. Next up will be Janet Slovin, and then it'll be Portia Patterson. Janet?
Yes, thank you so much for the opportunity to give testimony today. Thousands have lost their lives to COVID. Enormous sacrifices have been made in the past 2 years. Families separated in times of extreme need, the elderly isolated, children denied a proper education and necessary social interaction, jobs lost, hospital workers overextended. Well, with all that, how is it that those who are supported by taxpayer dollars are unwilling to do their part for the public good? Those who are entrusted with protecting us are putting us at risk by refusing to be vaccinated. It is unacceptable, it cannot be allowed, and there must be consequences. Thank you.
Thank you, Janet. Next up is Naporsha. Naporsha, we're trying to bring you over. Just for folks who are testifying, so you know, you do have to accept our invitation to be a panelist. So just watch your screen when you're coming up. And while we're getting Naporsha in, just after her will be Laurel Radwin. All right, Naporsha, I see you, so you have the floor.
Okay. Hello, how you doing? My name is Naporsha Patterson, and I am
Naporsha, we're losing you. We can't make out the words. Maybe try turning off your.
Sorry, my background's loud. I'm at work.
Naporsha? Yeah, maybe there we go. Yeah. Yeah, that's perfect. I think, yeah, you don't have enough bandwidth. So go ahead.
I was saying was that I am a Boston resident, and I wanted to speak on the mandate. I feel as though that there shouldn't be a mandate. One being that there's still people out there that are vaccinated that are still catching COVID. Where else do I go with this? Vaccinated people are still catching COVID. There hasn't been a long enough study to even give out a vaccine. And then they want to talk about Black residents or Black residents not being vaccinated. And it's like, how can you trust the government, a system where they have time after time shown us that they don't care about our health. They don't care about our well-being. If they really cared, then they would offer people to boost their immune systems by eating healthier instead of pushing a vaccine on people and children. I'm just against it, and I'm sorry I didn't have my thoughts together. I've been listening and kind of flustered at the moment right now, but I just think that it's inhumane, honestly.
Thank you so much, Naporsha. We appreciate you testifying. And it was good to see you briefly. Sorry about the bandwidth issue.
That's okay.
Next up is Lori Radwin. Carrie, can we bring Lori over? And Lori, you may need to accept an invitation. Okay, Lori, I think we have you in now in two formats. So if you can unmute and give your testimony.
Yeah, can you hear me now?
Yeah. You might want to turn the other one off though, because we're getting a little echo.
Yeah, I'm eager to testify. I put on everything I had. Thank you very much to the makers. Thank you, Councilor Bach, for allowing me to speak. My name is Lori Radwin. I've been an acute and critical care hospital nurse for nearly all of my decades-long career. I've taught critical care and acute care as well, and I'm also a health services researcher. I have had boots on the ground during endemics and pandemics, including Legionnaire's disease when we didn't even know the causative agent. I've been in an ICU then with H1N1 and so forth. So I want to say that I'm also a health services researcher. So I'd like to comment on the docket. The docket begins with statements about COVID-19 that require clarification. Specifically, even viruses that are in labs only, such as smallpox, can theoretically be transmissible. For the next hearing, I think in public health, an epidemiologist may be required to testify on transmission. COVID-19 infection appears to depend on the variant, and so an infectious disease specialist may be needed to testify how COVID vaccination may or may not protect of infection. The testimony might include those who, even with vaccination, may get COVID, including those undergoing cancer treatments, having had organ transplants, and the like. On the other hand, the upcoming docket, I guess, because this one's on, might well be about common goods and resources. with rights and public health as the focus. At this stage, my attention as a nurse and a resident has shifted away from vaccine requirements. Rather, I'm looking at Boston as a whole. The mental health of nurses who are leaving the field would seem to require testimony from a Boston member of the American Association of Critical Care Nurses, not in and of itself a union. Hospital and clinic chiefs of staff can speak to the loss of preventive care screening and effective care. Healthcare economists can reflect on the zero-sum game when COVID-19 treatment costs eliminate financing other health initiatives. In sum, it seems to me that the union issue cannot be divorced from the public good and public health in these COVID times. Testimony from experts is warranted, along with the unions and the few COB administrators that were named at last week's council meeting. I also just want to add the COVID dashboard is not intuitive. However, it's been my experience that the most up-to-date data is available at least twice a week. So I hope that's helpful, and thank you for your time. And I've mailed this testimony to the relevant counselors. So thank you.
Great. Thank you so much, Laurel. Next up, I'm going to try to go to, we have a Mr. Livingston. And again, if you can just state your name and your residence at the beginning, that would be great.
Yeah, what are you making?
Great. Go ahead, you have the floor.
Yes, Madam Chair, thank you very much for having me today. City Council members, everyone talks about science. Let's look at the science of this quickly. Hundreds of people are working in City Hall. It's been shown, studies have shown that people that have been vaccinated, revaccinated, and boosted can still get COVID. However, our mayor appears to believe that as long as you're fully vaccinated, that you can walk into a building with a few hundred people and then no one's walking in that building vaccinated. If it was truly about health, every city worker who walks into a city building should be tested on a daily basis. If this wasn't a political issue and it was a health issue, that would be the case. When it comes to the businesses, our mayor would like to think that if hundreds of people walk into one restaurant at night, thousands throughout the city going to venues and other restaurants, that those people passing through those doors because they have a passport card are not carrying COVID-19, which is untrue. I think the most important thing that has been said came from Councilman Baker. This city council needs to participate not only on this issue, but every important issue that comes before this city. The mayor cannot arbitrarily pull figures out of the air and use them to hold the people of this city hostage. And I would just like to comment on the unions real quick. Boston Patrolmen's Association, the Firemen's Union, and other unions, as Councilman Flynn knows, Councilman Flaherty knows, knowing the union well, you cannot just arbitrarily toss collective bargaining agreements into the wastebasket because you don't like them. And that's exactly what has happened here. And what's sad here is that Mayor Wu is a mayor. Does she not have any respect for contracts? Does she not have any respect for the law? Does she not have any respect for the citizens of this city who have a right, a human right, to work without being vaccinated? We need to pay close attention as to what's going on in this city. Democracy was born in this city. Let it remain in this city. We cannot live under a dictatorship. Let the Boston City Council stand up and do their job. Thank you very much for your time.
Thank you, sir. Next up is, DB Reef. And then I've got, before DB goes, Carrie, if you can bring her over, I've got Mark Sanders, a PJ McCann, and someone, Ralph, who I don't have a last name for, in the Zoom. We don't have you on the public testimony list, so if you want to give public testimony, if you can just raise your hand, that would be great. And Ralph, if you give us a last name, that'd be great. And then I would just say, I also did have a sign up from Alex Stein, who I don't see. So Alex, if you're watching it on the live stream, please do log in. Now I'll go to DB. DB, you're muted.
I think I know by now. Thank you, Councillor Bach. Thank you to all of the councillors and everybody who has testified because it's such an important topic. I originally simply was going to ask a question that I think is an important question. Is this, in late 2020, the state changed how they calculated positivity rate from positive per person, positive tests per person, to positive tests to the number of tests given. And that made the rate look much lower. I mean, there wasn't any less COVID, but the rate really dropped dramatically. And I don't know, and I can't seem to see online how the city calculates that rate, but I think that it's important to be mindful about which one the city is using and what the ramifications of that are. So that is my question. I want to say two things. That one, I think, I live in Brighton. Sorry, I didn't say that. And we count on the police for our safety. I know that right here, a group of neighbors meet with the community police officer monthly. We've done that for years, good weather, and we've stood outside and done it. And I wouldn't feel safe meeting indoors with anybody that wasn't vaccinated. And it just seems to me that for the body, for the organization, the people whose mission is safety, public safety, that no one should feel endangered by virtue of being in close contact with them. I want to say also that I have been a member of a union and I have utmost respect for unions. And when I think back on all of the union activities I took part in, and I took part in a lot of them, never would it have crossed, I don't think, anybody's mind that it was a union right to do something that affected public safety or potentially affected people's safety. And the last thing I want to say is that my family has not gone out to eat in a restaurant since the pandemic began. But now that restaurants will require that, I know that everybody there, every employee and everybody who goes into there has been vaccinated and maybe boosted. We're actually thinking about going out to dinner tonight. And, I think that's one of the ways Boston will move ahead economically and socially, is by having more people feel safe, whether it's interacting with police, people at City Hall, or going into restaurants. And so I applaud the measure, and I would like to get an answer to which calculation the city is using. Thank you.
Thank you so much, DB. And we will add that to our information request over. So we'll get that answer and post it publicly. All right, I don't see any hands up from the other folks in the Zoom. This is your chance again, if you wanted to raise it, to do so. And I think the other folks who are signed up for public testimony, I don't see. We do have some written letters of public testimony that have come in. And so I'll make sure that those get circulated to councilors. And also, of course, they'll be preserved as part of the record of this hearing. So I think if you're trying to catch very last minute public testimony, you should email ccc.csit@boston.gov right now, because we're going to wrap up the hearing in a second. But I will just give councilors who, if I saw Councilor Baker's hand go up, so I will give him the opportunity to speak again. And then any other councilor, if you had a last word you wanted to get in, and we'll end on Councilor Murphy. Councilor Baker.
Thank you, Madam Chair. Good job in this committee hearing. There were some interesting points made about the teachers union there. Were they invited to this hearing here today?
Yes, Councilor Baker, they were invited, and because they reached an MOA, they declined to attend.
Well, I mean, I think there's some discrepancies in an 80% vote of their body and like an e-board decision there. So I'd like to get some clarification. I mean, I know it's bargaining, but I'd like to know what that vote looks like. I know that's question form. We're at the end here. If there is an opportunity to do that, if not, I can probably figure that out on my own, but I'd like that to be part of the record. What was the actual vote? Was it a membership vote? Was it an e-board vote? Because again, looks like it happened behind closed doors, and that's what we're trying to shed a light on here. Thank you, Erin, for filing this hearing. Thank you all to all the unions that make the city actually work. And I know that you care about the city. And there was one thing that I see thrown out there a lot, that the unions are greedy and they're looking for a payday. This is not about a payday. There's no talk of extra money or anything like that. This is just around the vaccine, just around the MOU that we have there. And so just wanted to make those couple of points. Again, Councilor Bach, thank you for your shepherding through this here today. I know it was not easy.
Thank you so much, Councilor Baker. And unless I see any other councilor hands, I'm just gonna go to Councilor Murphy to close us out. Councilor Murphy.
Yeah, so I will just say again, thank you to you, Chair Bach, and my colleagues for being on this call, for the unions who came and spoke. You were heard, and I do believe that we're leaving this meeting with a better understanding and more information, and also to Dr. Ojikutu, who was on first from the Public Health Commission. We have questions, but I do feel like the questions I have now are coming out of having more knowledge and being able to move forward. And I do hope that the unions are able to sit down soon with this administration, and that we're aware of that and supporting as it goes forward. And I did also just want to thank the public testimony, the people who came on at the public testimony and listening to your, your comments and your questions. So thank you, everyone. And I am glad that we had this hearing, and I look forward to the hearing next week also on public health. Thank you.
Thank you so much, Councilor Murphy. And again, I just want to echo the thanks to everybody who testified and everybody who sent in written testimony, and also to the labor partners and to the administration for testifying, and of course, all my colleagues. With that, this hearing of the Boston City Council's Committee on City Services and Innovation Technology is adjourned. Thank you all.